Welcome to No More Desire, where we build a mindset and lifestyle for lasting recovery from porn. My name's Jake Castleman, and I'm excited to dive in with you. Let's get started, my friend. Today, I'm sitting down with Dr. Doug Carpenter, licensed psychologist, author of Secret Shame, and a survivor, or in his words, a thriver of childhood sexual abuse. Doug, welcome to the show, my friend.
Well, thank you. I am very happy to be here, Jake. So thank you for the invitation. And I love talking about these kind of issues and helping men along their journeys.
Yeah, well, you bring a lot of value to this space. It's awesome.
Well,
So I'd actually love to kind of, before we dive into some of the themes of your book and talking about abuse and addiction and masculinity as well, could you share a bit about your professional background so that people can get to know you a bit more, kind of what led you into the field of psychology and up to this point? That's a long story, but whatever you want to tell.
I can try to give you the Cliff Notes version. So I graduated from high school early, and so I jumped right into college. And I first went to seminary thinking that I wanted to be in the ministry. And about a year and a half into my studies, I was like, this is clearly not what I want to do. I want to help people on an individual basis. I want to really be sitting down and working with them through their hurts and the pain and traumas of life. And I'm like, this is not the profession to do that in. So I jumped out of seminary and jumped into university in New York City and started working my way through an undergrad program in psychology and then a master's that's actually specialized in addiction.
Yes.
So my grandfather was a raging alcoholic, actually drank himself to death in an apartment in his late 60s or 70s. I'm not even sure because I wasn't ever allowed to know him or be near him because he was such a severe alcoholic. And I think what piqued my interest about that is my grandmother and other people who knew my grandfather would always be like, you're so much like John Harvey. Like, and I'd be like, well, this is somebody I don't know. Like, you look like him. Your mannerisms are like him. So then that always piqued me about my own addiction tendency, or could that be a possibility or part of my own storyline? So I went into a field of addiction. And then after my addiction master's program, I went into a clinical psychology doctoral program and earned a PsyD, a doctorate in clinical psychology. And it was during that time that I did a lot of my practicum, internship, residency in a jail setting. And none of the other psychologists wanted to see the sex offenders. So I took them all on my caseload and started seeing them. Yeah, and really started seeing the degree and the amount of trauma they held in their stories and how this was just a deep, deep replication of what they had experienced and what they had been through themselves. And so I applied all my addiction knowledge to sexual trauma and how they then turned that into their own sexual compulsivity and began to help teasing them apart. And it was really rewarding when I was writing one of my books. I think it was this one. I actually had a man contact me who I saw 25 years ago in that jail. And he said that he had never repeat offended and he had been clean. And it was so rewarding to just know that, you know, a small portion of my life helped somebody overcome the severe trauma they had been through and then that they had perpetrated on other people, but then had found a way out and were living as a survivor.
That's
that's my goal.
Yes. Yeah. It's those moments when your work really means something to one person and you can see how much it changed for them. That makes all of it.
It makes all the difference in the world. Yeah. And part of the reason why I chose to write this book is, you know, throughout the years of being a clinical psychologist, and the further I got into the sexual addiction field and the further I got into the sexual trauma field, there just was not a good book out there to help, that I felt truly spoke to victims of male childhood sexual abuse in a way that was understandable to them, that they could relate to. So I took the next 6 years and I read hundreds of articles and books, and I wrote my own book. And it has a workbook, and there are several men around the country using it to run male recovery groups for men who've been sexually abused. And there was not a book out there that helped men understand the link between their past sexual abuse and their current sexual behavior, whether that be some kind of compulsive behavior, some kind of fetish, some kind of avoidance, some kind of anorexia. And I felt like that was a really important link. So
It is.
naturally, not everybody who is sexually abused ends up being a sex addict or having some kind of compulsive sexual behavior, but there is a high correlation to sexual dysfunction from male sexual abuse. And then if you look at the sexual addiction research of men, a high percentage of those men, in fact, one study shows up to 80% of men who have a sexual compulsivity have experienced some kind of sexual abuse. So I knew that
Wow.
there had to be some significant link there. And so I tried to write a book that showed how that link could happen so people could begin to understand that process for themselves.
I think, and you really drive that home in the book, Doug. I think that one of the things that I learned reading it is how prevalent male sexual abuse is and how under-recognized it is. Because we
Extremely.
think of, yeah, we think of female sexual abuse so often, and that is horrific and tragic, and but the males often get neglected. And
Very much so.
can you talk about more why that is from what you've seen?
Well, for definitely societal expectations of men. Men don't tell. We'll probably talk about this more later, but the average number of years that a man waits to disclose his own sexual abuse is between 25 and 26 years. And
Mm-hmm.
typically that's not because they're disclosing because they need to tell someone about the abuse. It's that some other behavior has gotten them in trouble. Their drinking, their alcohol, their inability to sustain relationships, something else brought them into an office of somebody who was a mental health professional and began asking them questions. And then the disclosure happens.
Yeah.
So it's
Hmm.
not something that men just set out like, oh, I need to process this. I need to talk about this. And, in our society, men are not seen as victims, especially of sexual crimes or abuse. There's a couple of different studies out. One shows that 60% of mental health clinicians don't ask males about sexual abuse. And so we as a
Wow.
mental health profession have to change that. And then in the medical profession, it's up to 80% of medical doctors never ask a male if they've had any type of sexual abuse or sexual assault. And if we
Hmm.
just look at that from a statistics base, the research shows about 1 in 3 women have been sexually abused. And when I'm saying sexually abused, let's define that. It's being touched in some sexual way that you did not desire. Okay, so whatever that might be, I'm going to just leave it with that. And
Hmm.
that's actually a huge problem in the field of studying sexual abuse is there is no unified definition of what we constitute as sexual abuse or how we describe that. So every study has a definition. I actually did my dissertation on a study of the disparity of sexual abuse laws across all 50 states. So I analyzed 250 laws across 8 different variables and showed how much disparity there was even in the law about this that makes it so difficult to track accurate statistics. So
Wow.
statistics when it comes to females tells us that 1 in 3 females have been touched in some way that they did not invite before the age of 18. Male research is 1 in 6, but we believe that's severely underreported for number one, because of the lack of definitions that are used. Number two, men don't typically disclose, don't tell, are less believed, are sometimes punished when they tell. So we think the prevalence is much higher than what it's actually reported as.
Now, and I've heard the statistic, one in four women, or one in five. Are these just from depending on where you see it, or those old stats that I've seen?
No, probably. I mean, you're going to find it out there in different ways, but I've read hundreds and hundreds of articles, medical journals about this topic, and the most frequently occurring number for women is 1 in 3 and 1 in 6 for men. In fact, there's a website called
Mm-hmm.
1in6.org that is all about male sexual abuse and talks about it being a 1 in 6 phenomenon, but then also talks about the real limitations in collecting actual data. Because just like I said, a lot of providers don't ask
Yeah,
about the history of sexual abuse. And the
yeah.
APA and SAMHSA have both encouraged all clinicians, medical and psychological, to have the same intake process for men and women and to be uniform in asking those questions so we can do a better job at helping men.
And so, and this kind of leads me into my next question for you, Doug, and that's, you've been open about being a survivor of,
Yes,
or a thriver now, as it were, right?
it's a
Of
process.
right, that's right. That's a good way to see it, and that's part of why you are where you are.
Yeah.
So,
And that
yeah.
concept comes from an older book now that isn't really used a lot, but it was for women called Courage to Heal. And it talked all about going from a victim to a survivor to a
To a
thriver. And
thriver.
so, way back when that book was kind of the end book, at that time I adopted that language, and I've just never really left that language because I think that continuum is very appropriate from a psychological journey that a person who's been victimized goes through.
Yeah. And so I actually love what you said, which is, I'm still working on this throughout my life, right? Still going through kind of recovery from that, from childhood sexual abuse. And I wondered, if you might be able to tell people, because there's plenty of people who listen, both men and women, who listen to my podcast, who
Yes.
have this history of sexual abuse. Can you tell a bit more about your experience,
Sure.
as well as how it, because this is such a hard connection for so many people. I think it was really hard for me, how that history played into your own sexual addictions, if I'm not mistaken,
Hmm.
in
Yeah, I
that for
can
you. Yeah.
easily do that. And for many years, I did not define my experience as sexual abuse.
Hmm.
For one, it was with, uh, well, this gets complicated. So
Sure.
there were a couple
Typically
of
it is, right?
different
Yeah.
instances. My first round of sexual abuse was with a female when I was at the age of 5. There was a girl down the
Mm.
street who was probably 9. And every time that we were together, she wanted my pants off and to be exploring. And, years later, I clearly look back now and that she was clearly being abused and or being exposed to pornography in her home because the things that she was telling me at that age about my own body that I didn't even understand, there's no way she should have had that knowledge at that
Mm.
age.
Mm. Hmm. That's
Um,
sad. Yeah.
and then later in my life, my grandmother was blind, and I would spend the night with my grandma and grandpa a lot on Saturday nights, and then I would help take my grandmother to church on Sunday mornings since she was blind. And so on Saturday night, I always got a bath before church. Well, my grandpa used to chase me around the house naked, and telling me that he was going to pull on my penis.
Okay.
Okay.
Yeah. Yeah.
Um,
How
he,
old were
I,
you again, you said?
I was 10, probably 9 or
10.
10
Okay.
when that was occurring. At
Yeah.
the time, again, I didn't think that was a sexual abuse. I thought it was just my grandfather being silly and
Right.
playing some kind of silly game with me. But then
Yeah.
in
Yeah.
my teenage years, my grandfather was actually arrested
Oh
for
gosh.
um,
Oh wow.
being sexually inappropriate with one of my high school's friend's girlfriend. She was walking home from school and he picked her up and
Mm.
then assaulted her.
Goodness sakes.
So my grandfather never touched me, but he was very inappropriate with me and did some other physically abusive things to me, and he was very
Mm-hmm.
abusive to my father as
Mm.
well.
Well, and
So
you
then,
would have carried some of that too, potentially. I mean, genetically, that kind of
oh yeah,
trauma and abuse of your father, right?
oh for sure,
Yeah.
because
Mm.
my father, when I was growing up, really had nothing to do with us kids. Um, he took the mindset of when I was a kid, I was just hurt and traumatized, and I just wanted to be left alone and be a kid and not having my dad lord over me. So my dad took the
Mm.
complete opposite approach, and he was very hands off, non directive, didn't interact with us. And in his later years, he realized that that was just as hurtful and as just a big mistake as being abusive, that he neglected us. And so we had
Yeah.
to take many years and repair that
Mm.
relationship. But I also think not having my father in my life in a way that was emotionally attuned and attentive made me vulnerable with my grandfather, for
Yep.
sure, to want that male attention. And then
Yep.
later vulnerable with a peer who abused me, who, and this is one reason why I didn't label this sexual abuse for so many years, is because this boy started exposing me to pornography, which I had not ever been exposed to. I was from a very good little Christian family, who was very strict. No
Right.
alcohol in my house, no dancing, no rock and roll records, no nothing. You know.
Right. Let alone porn, right? That's not,
Oh,
yeah.
oh my
Yeah.
word. I didn't
Hmm.
even know it existed. And
Right.
so then this boy started exposing me to things. And then one day he said to me, "Can I show you something? Can I do something to you?" And I said
Mm.
yes, because I had
Mm.
no idea what he was going to do.
Yeah.
And then he acted out on me. And he acted out on me in a way that caused me to have my very first orgasm ever in my life.
Mm.
And I
Oh
was
my gosh.
petrified. I was terrified. I had
Sure.
no idea what was happening to my body. I had no idea why I felt the way I felt. It was not necessarily a pleasure. Instance was not pleasurable because I was
Yeah.
so terrified by it.
Yes,
I literally
absolutely.
didn't know if he had broken something in my body, something had went wrong. Like, I truly didn't understand what was going on. I was so young and naive.
Right. Well, and at the retreat that you taught at that I attended, by the way, you did again a brilliant job, Doug,
Thank
and
you.
we really got vulnerable and open about sexual education, and it's very clear how a lack of sexual education, and at that point you probably knowing nothing
Nothing.
nothing about sexuality plays directly into the susceptibility to being abused and then addiction and just a that reality of the more that you know, the more educated you are and the more openly it's spoken about, the less susceptible you are, and you just had no clue at all, which set you up.
Yeah, I had no clue at all. I was
Yeah.
very naive. I mean, my mom would have a fit if people were like really kissing heavy on the TV. She would be like, "Oh, that's so disgusting. That's gross. I don't know why they have to show that." Like, she would just, my mom is the prissiest woman on 2 feet. And she
Right.
would just go off. Oh, no, I mean, me and my sister joke like we don't even know how we ever got here with a mother the way that we had. But
So and also so you were carrying the message as well. This is definitely not something I should ever ask my parents about or talk
oh,
about
never
or
talk
think
about,
think
never ask
about
about,
or
never
right.
say. It wasn't
Yeah.
till I went home after that instance of abuse that I started to actually think about what I'd been taught in biology classes. And I'm starting to figure out, like, okay, is this what happened to me? Like,
Mm,
is
mm.
this is
Ah,
this what all this is? And then he continued to abuse me, and I continued to allow him to abuse me because I felt like that was the only way I could maintain a male friend, because I really didn't
right.
have many male friends. And so
Yes.
I feel like I sacrificed that part of me to just have a connection
Yep.
with
That
another
makes
boy who
sense.
would be my friend.
That makes
And
sense.
then I think, because once I then recognized that what he did to me resulted in an orgasm, I then thought, well, can I replicate this myself?
Right.
So then I think it led to a pretty compulsive masturbation issue. I felt like it was traumatic and terrifying for me how that was discovered.
Yeah.
And I blamed myself for years
Yeah.
because I said yes.
Yeah.
You know, when he asked me, "Can I do something to you?" I said yes, not knowing what was going to happen. And so feeling like,
Right.
okay, this boy was the same age as me. And then um, me saying yes, and him having exposed me to all this pornography. Like, and his home pornography, it was literally on the coffee table. It was in the bathroom. It was downstairs on the poker table. Like his mom and dad just had it out like it was nothing.
Oh, wow. Oh my gosh.
Which
And so,
I look
yeah.
back and I don't have a lot of anger or resentment at that kid for what he did with me, because in my mind he was being just as abused as I was. Like, he was put in this
Mm,
very sexualized environment where this kind of behavior was just supposed to be seen as normal. And so I think he was really just trying to share with me something that he was finding pleasure in.
right.
You know, so
Yeah.
I've never held a lot of anger or resentment toward him because I feel like he was being just as traumatized as his experience with me was. I feel like we were
Hmm.
two innocent kids that were being exposed to things that we didn't have the cognitive knowledge or ability to process.
Yeah. Yeah.
And I
Exactly.
realize that for a lot of victims, that's not the case. They're, you know, they have a lot of feelings toward their aggressor, and as they should.
With this topic as well, and kind of you developing this, compulsive masturbation after being abused by a peer who's your same age, right? There's all the shame I can imagine going along with that experience where, um, okay, I'm doing this now alone and isolated. My parents don't know about it. What if they knew? What would they think? Is this something I should be doing? I don't know. It feels so great. And then feeling like you can't stop. And I mean, can you talk more about what that was
Oh,
like
sure.
emotionally?
Like, you know, and I tell people this all the time. When you are exposed, so if we look at Freudian theory, the latency stage is like from 6 to 12. So in any kid's life during those years, you're really supposed to be gaining a wealth of knowledge about procedural things, about how to do things. That's where you start learning to become independent. I learned to brush my own teeth. I learned to make myself a bowl of cereal in the morning. I then learned how to cook an egg. You know, like, it's
Right.
this whole period of learning how
Mhm.
to adjust and be in the world, and that is not supposed to include any type of sexuality at this point. You're cognitively not even ready for that. But
Yeah.
I think people who are exposed to things like that, I always say it flips on a switch, almost like a light switch inside
Mm,
of you, where you become sexually curious. It makes you
okay.
think about bodies and people and behavior and touching, and notice things that other people don't notice. Or when you're around other kids playing, you make sexual comments, or you turn the play into something sexual, or because your brain has been turned on to this new idea that on some level is an adult thing, but you're a kid and you have some knowledge of it. So that
Yeah.
really begins to play into your behavior. And mine started at 5, with that, or before,
Mm,
um, with this young lady, and then continued. um, so I think as a kid I was pretty preoccupied with things of a sexual nature, and I really felt like I was lacking a masculine role model, which
yeah.
was already messing with my sense of masculinity and who am I, and how am I supposed to be developing as a boy, and what am I supposed to like and want to do and not want to do, and what's okay and what's not okay. And
And
so
you
once
just
I,
you just feeling that all the time, right? And having no idea that you were even experiencing that, right? All this is going on kind of unconsciously and just the world you grew up in.
yes, even though I knew I was curious, but I
Mm,
assumed my curiosity was the same as everybody else. And maybe
right.
it was, but
Sure.
I do see a lot of people where that switch gets flipped on very early. And those, when you experience something as a kid, then you start acting it out with other kids around you. You
Yeah.
start searching out pictures or pornography, or, it wasn't easy back in my day. You had to go steal a magazine out of 7-Eleven if you wanted to see pornography.
Right. Yeah. It is so
It's not
far
like it
from
is
that
now.
now. Yes. It's gone in a completely opposite direction.
Not that I ever did that.
Right, of course. Obviously. Yes.
Um,
It's
but yeah,
it's
then through my teen years, I think I was in very much of a dilemma because I was still a very strong Christian boy trying to do the right thing, but yet I
Mhm.
had all this sexual energy stirring in me that I didn't understand. Nobody was talking to me,
Mhm.
nobody was explaining anything to me, nobody talked about what was appropriate. In fact, this is somewhat embarrassing, but when I was 19 and at college, I received a letter from my mom about be careful that you don't masturbate too much as a young man. I
Oh
was
my gosh.
19. I'm like, Mom, this started before I was 12. Like, where have you been? Like, you're a little late to the game, don't you think?
She's just bringing this up. She's like, I know that you may start to have some of these feelings.
Right. I'm like, I've been at college for over a year, Mom. A year. I left home at 17 and a half. I had to fly back from college to graduate high school.
Oh my
And,
gosh.
and you're just now addressing this? I'm like, whew,
That
you're
is
way off the mark.
that's this happened some time ago, Mom. Some time
Yes.
ago. So in your book, Doug, Secret Shame, you talk about how many men carry wounds they don't even recognize as trauma, right? And we've discussed some of that. What are some of the subtle ways that early sexual or emotional wounding can show up later in a man's life, especially in addiction or struggles with intimacy, struggles with
Sure.
relationships?
So, like I was saying, that switch gets flipped on early. I think you see a lot of people who have been exposed to male sexual abuse or pornography, or that switch has been flipped on early. They tend to be a little more physically pushy in their relationships because they have imprinted on the sex, not imprinted on the person.
Mm-hmm. So,
If we look at what I think, from a Christian standpoint, how God designed sexuality to be is that, you go out with the girl, you hold hands with the girl, you eventually kiss the girl, you keep dating the girl, you fall in love with the girl, your sexual desire goes towards the girl. But now we live
right.
in a generation where at 8, 9, and 10, kids are being exposed to pornography. So that what's being written on their sexual templates and their imprinting is the sexual behavior, sexual behavior, sexual behavior, sexual behavior. Well, in order to do this, I just got to find a partner. Doesn't matter who, doesn't matter how many. I don't even have to be
Yeah.
discreet.
Yeah.
I just need a
Yeah.
place, a person. And so that process of imprinting is so difficult and problematic, I think, in today's world. I have a
Mm-hmm.
urologist that actually sends me teenage boys and college boys who are having a lot of erectile dysfunction and problems ejaculating because they've watched so much porn and masturbated that they've just got their system so messed up with dopamine regulation that
Mm-hmm.
they're not functioning normal.
Right.
Yeah.
Yeah. Porn-induced erectile dysfunction,
Yeah.
right?
Yeah. Yep.
And it's something that I struggled with, right,
Okay.
for
Yeah.
years. And I had nobody that I had talked to that about. I had no clue what was going on with me. I
Right.
was terrified. I'm like, okay, I guess I feel like an old man at the age of 18. I don't know what's wrong with me
Right.
until I eventually heard someone use the term PIED, porn-induced
Hmm.
erectile dysfunction, and
Yes.
that blew my mind. I was like, oh my
Right.
gosh, it's a thing. It's not just
It is
me,
a thing.
right?
It truly is a
Yeah.
thing. Like I have, like I said, a medical doctor, a urologist who sends me people because of this.
Mm-hmm.
But I think some other
Mm-hmm.
ways that it can show up, like I had one man who came in and he was having a problem with premature ejaculation. And so we started talking about that. Well, once I dug into that, when he was 15, 16, 17 years old, I think he was on it was either a football or a soccer team where the coach was actually abusing the young men. He would have them stay over on the weekends, take them to their practices and stuff, but he was sexually abusing them at
Ugh,
night.
gosh
And
dang it.
this boy learned that if he could ejaculate as fast as possible, that the coach would leave him alone and he would go on to the next boy.
Right. And so
So
the
he,
mind, yeah, the mind and the body, right?
yes,
Kind
yeah,
of,
he
yeah. Hmm.
basically trained himself to ejaculate as quickly as possible. And then as an
Wow.
adult, he couldn't unwire this. He needed a lot of help learning to unwire that.
That's
And
incredible.
then on the flip side of that, I had another guy who delayed his ejaculation because he felt like if my abuser made me ejaculate, that was going to mean I'm gay, I'm a homosexual, that I liked this, that I wanted this. So he just would hold back, hold back, hold back, hold back. And now in his adult years, he's having trouble with delayed ejaculation because he trained his body a certain way. And that's two examples of two extremes that go in the exact opposite direction. But
Hmm.
it's still, anytime there's sexual dysfunction in a man, well, let me say this, 20 to 30% of the male population is experiencing some form of sexual dysfunction right now. It
Wow.
happens to all men. It usually lasts less than 6 months. It's a common occurrence in men, but there is definitely a degree of men who experience sexual dysfunction that's directly related to their sexual abuse. I also have men who are extremely sexually compulsive because that switch had been flipped on so early in their life. I also have seen a lot of men who are what I'm going to say sexual avoidant, sexual asexual, sexually anorexic. They avoid sex because it was such an awful experience for them. It was dirty
Yeah.
for them. They have so much shame. I talk about one guy in my book. I use 13 live guys' stories in my book to back up the research. And one of the men that I have in the book here, I nicknamed him Vince, but Vince talks a lot about his adult sexual behavior and how much he struggled with intimacy with his wife and just would wear 2 and 3 condoms so he wouldn't ejaculate too early because he knew he wasn't satisfying his wife. And then he just could not separate sexual intimacy from his sexual abuse. And that's something
Yeah.
that really has to be teased apart with people who have experienced male sexual abuse who are still having some lasting effects. They have to
Hmm.
understand this is a loving, sharing, intimate moment with someone who loves you and cares about you. This is not abuse, even though some of the same behaviors may be happening.
Yeah.
It's very difficult for them to separate and create a healthy sense of intimacy.
Yeah. And when you mentioned sexual anorexia, Doug, it made me think of myself. Honestly, I went through a period of that for years because from the time I was, 12, 13 years old, all I knew was that anything to do with sex, right, or those feelings, arousal, desire, was always coupled with shame, dopamine spikes and drops,
Yes.
feeling terrible about myself. It got in the way of my life and who I wanted to be. That is how I saw sex. And it took me years of healing and training my mind and, doing spiritual practices, bringing in prayer and meditation and journaling, all to work through my pain and work through, okay, why do I think about it this way? And how do I feel?
Right.
And what's the shame behind it? And being able to move through all that emotion, because to me, that's where I went. And I didn't realize that for a long time, that's
Right.
kind of how a part of me chose to cope, was just to
Yeah.
just avoid this altogether.
Mhm.
Right.
Well, and that's why we haven't talked about husband material yet, but I'm heavily
Mm,
involved. I'm the clinical director for husband material,
mm,
and their whole concept is to outgrow porn. And I think that concept applies to many of these issues, that there are wounds in our childhood that we have to mature through. We have
Yeah.
to outgrow and learn a true healthy adult mindset. Another thing that I really see is due to abuse, men have developed certain fetishes or affinities towards certain things. Or, for example, men who are still aroused by other men, even though they're heterosexual and don't feel like I have any desire to be homosexual, but you have been conditioned to respond to a man's touch and to a man's body because of potential years of abuse. You know, it may have been a few times, it may have been many times. And
Hmm.
so learning the difference between your body's automatic arousal pattern and erogenous zones can sometimes be very different and polar opposite than what I consider your sexual desire to be.
Yeah. Well, and I know for me how eye-opening it was at the retreat to see how many men that we were there with had SSA, right? Same-sex attraction.
Yes.
And how many of them they had this history of sexual abuse that was connected with that. That was very eye-opening for
Yeah. Well,
me.
I think it goes back to that whole process of imprinting, because if your first sexual experiences are with a male, that's going to be the benchmark that your mind then uses for several years until you begin to gain other experiences to draw from. You know,
Hmm.
so many boys are being sexually abused by men or other boys are just being conditioned to respond a certain way to another male, and that other male has become their sexual prototype in their head. You know, one thing we say in the drug addiction world is, especially if with heroin or cocaine, you're always chasing your first high. You know,
Right.
I never get as high as my first high because
Hmm.
your body wasn't used to that. It was like such a new experience. Well, the
Hmm.
same thing's kind of true in a sexual template. The early sexual experiences you have are typically so emotionally heightened, and anytime emotion is really high in the brain, your memory, it's just like stamping it into your brain. Like memory consolidation is going to be very, very, very high around emotional situations. And so a lot of these sexual abuse situations are highly emotionally charged and become your prototype for behavior that then sticks with you. And
Hmm.
also in the addiction field, we talk about any addictive behavior that starts before the age of 14, just due to cognitive development, is you're likely going to have a lifelong struggle
Hmm.
with this if it starts
Wow.
before the age of 14. Just from a neuroscience standpoint, because of the way your neural pathways,
Hmm.
neurons
Hmm.
that fire together,
Hmm.
wire together. We've all
Right.
heard that statement, right?
Right.
And so if
Right.
that's what you're being exposed to for many years,
Yeah,
that's
exactly.
that's what you're going to be drawn to or aroused by. And then, later in life, I will work with men who come in and say they have SSA, and I'm not saying that they don't have same-sex attraction, but is this just an arousal conditioning that you've experienced and it has nothing to do with who you really want to be or what you really desire for your life? Let's
Right.
recognize how you got here and why you got here, and stop attaching so much meaning to this as far as self interpretation. Like, they make so many doubts about themselves. Like, well, I must be gay. I must have been gay. The perpetrator must have seen something in me that let him know I was gay
Um,
before I even knew it. Look at the way my body responded when he did that to me. So my body betrayed me.
right.
So they develop
Yes.
all this mythical thinking about the behavior, trying to make an interpretation and make meaning of why in my heterosexuality do I hold this homosexual piece.
Hmm. Yeah.
Two things that stand out to me. I was reading an article one time, and it had quotes from victims in there, and one victim actually said, "I felt my maleness leaving my body during the abuse."
Oh.
And I thought that was such a powerful statement. And then I think
Mm.
most of us know Tyler Perry, the big movie guy.
Right. Right.
When he was on the Oprah show, when she had 300 men in her audience who'd been sexually abused, that was like back in the 90s sometimes. And he was he was the guest on the show that day. She asked him, have you had any sexual identity confusion from being abused? And he said, how could I not? How was I supposed to hold what this man had given me inside of trying to develop my heterosexuality? Like, how could I have not
Yeah.
experienced
Right.
that? And I told you that I had read hundreds and hundreds of articles, and the number one side effect of male sexual abuse is sexual identity confusion,
Mm-hmm.
because it's how they begin to make interpretations about themselves, what happened, why would this happen, and
Right.
unfortunately, the way the male body is designed, it's a very external genitalia, and we have a lot of erogenous zones just like women do, but we respond to touch and
Yeah.
visual stimulation, and you can't control sexual arousal. And
Right. That's right.
so then I think many men just really misinterpret their process of arousal, and that your body's just doing exactly what it's supposed to do. But now you're making
Mm-hmm.
some kind of negative interpretation about that. And then that shame that you hold about that then becomes toxic shame. A bad thing happened to me, but it wasn't just a bad thing. Now I'm a bad person.
Yeah.
I'm a bad person who did a bad thing,
Right. Right.
which is very inaccurate,
Mm-hmm.
and something
I
else you have to work with people who have sexual compulsivity and addiction and anorexia and past history of male sexual abuse.
mm. So hard and so complex. That's why we need professional help to be able to work through things like this.
Yeah, one thing that I try to really push in my seminars, I've spent my lifetime studying men, not studying women. So anything I say is not to compare how men react to versus women to react. But when I teach about male sexual abuse for other clinicians, and I'm teaching them, male sexual abuse is so profound to a male, because it's not just an attack on my physical body and my sexuality. It is a full out attack on my sense of masculinity,
Mm-hmm.
who I am. How do I define myself? How do I see myself? Because most boys, a lot of boys who get sexually abused, no longer see themselves like as a true boy. Like, I'm not a real man anymore. I'm not a real boy anymore. I've touched another man. I've had to perform oral on another man, or they've done that to me and my body responded. Like,
Yeah.
they don't see themselves as real men. They see themselves as becoming feminized in some way.
Right. Yeah. Yeah. And so let's actually talk about masculinity, particularly. So when a boy or young man is sexually abused early on, how does that injury shape his sense of manhood and the ways that he shows up in his relationships? What are some of those kind of confusions or the things of self-worth or the burdens that he can carry around that really
Well, definitely. And I
yeah.
will tell you this, like, I see a big difference, and I don't have full research to back this up. So this is just in my 28 years of practicing.
No big deal. Just 28
Yeah,
years,
no,
I'm
no big
sure.
deal.
Yeah.
Yeah, I had a lawyer one time when I was on the stand question me, how many people do you think you've seen? And I was like, I've been doing this for 28 years. And I stopped and calculated in my head, and I was like, well, this year alone, I've seen 3,000. So I don't know.
You're
That's
like,
a good,
give or take a few 10,000. I
yeah,
don't,
right. Yeah, give or take. But in my experience, I have found that males who are abused by females tend to have a very different reaction than males who've been abused by males. It's been
Mm,
my experience that men who are abused by females tend to become super hypersexual. Like, I will never let
mm,
another woman put me in a vulnerable position. I will take advantage of them first. I will drive the sex. I will be the initiator. I will be in control of this. We're going to do what I want. So if
mm,
you take the, just the urban phrase man whore. I see so many men who've been sexually abused by women turn into man whores and just have multiple partners with women. And it's all, I think, due to an attack on their sense of vulnerability. Their
So
power
it's
and control was violated.
hmm
I think of one man that I saw who at 13, he's about my age. So back in the day, you could get a work permit and work before you were 16, which he had to do. But he worked at a pharmacy while his female boss ended up sexually abusing him, raping him, actually. She forced him to have sex with her, and he was 13. And he
oh
didn't want
wow.
this to happen. And he has talked so much to me about that whole process of how that impacted him and the vulnerability that he felt like was ripped away from him, that he was never going to put himself back in a vulnerable position like that. So he was going to make sure he was the initiator, taking charge, being in control. And I've seen
hmm
that over and over and over with men who have felt violated by women.
And I think it's very important. We within this field we speak in unconscious terms all the time. What's going on in the unconscious mind?
Yes.
You're not consciously aware that you're doing this, or it's
No.
now I'm going to take control. It's all in the
No.
unconscious mind, right?
No.
Yeah.
He was not really conscious of that until like he was in his 40s and was in therapy with
Right.
me. And he'd been
Yeah.
like, okay, I've been through 2 failed marriages. I've been through 150 women before I found these marriages. And I
Goodness.
need to change my life. And I need to
hmm
figure out what's wrong with me. Like, why am I
hmm
continuing to make these unhealthy relationship choices and patterns?
Yeah. Well, and so in your experience, Doug, this kind of journey from victim to survivor to thriver, as it were, right?
Yeah.
Not your phrase, but
Not my phrase, but I
right,
use it.
right, right. What does what are some components of that transformation in a practical sense for someone who's a man who's in recovery and trying to work
Well,
through
I think
this?
somebody who's moving from, first of all, in being a victim, you have to recognize you were a victim and then be able to say that. And you need to find your voice and be able to tell someone your story and be heard and believed and attuned to. Then you move on. Did you want to say
Yeah,
something about that?
I wanted to say, I think a lot of people, when you say that, they're like, why? Why do I need to talk about it? Why do I need to bring up the fact, can't I just move on and, live the rest of my, or can't I just be strong? So explaining to them kind of why they need to talk about what they went
Right,
through and,
right.
and go through that
Just because you
process.
have an infection in your body and you can't see it or smell it, should you not take antibiotics?
Mm, hmm
I mean, there's a
Yeah,
sickness in there that you've got to treat. AA says we're only as sick as our secrets.
right.
You
Yeah.
know,
Hence Secret Shame, your book, right?
yeah,
Yes.
the
Yeah.
secret shame. Yeah,
Well, and
it's
the confession process, right? You put it in a spiritual sense, or the therapeutic process to be able to emotionally process through traumas and all that.
yes,
It's absolutely crucial. We have to start there. If you don't, then you haven't defined the problem. You don't understand yourself. You can't ever
right.
find, any kind of healing.
Well, and so many men don't recognize that I was a victim. They think,
Mm,
well, my body responded. I must have wanted this. I must have enjoyed this. It eventually did become pleasurable.
right.
Sometimes I
Right.
went back to my perpetrator and I even instigated it.
hmm
But
Right.
you're instigating it for a deeper level of emotional connection.
Right.
Sexuality is just the avenue to get that need met.
hmm hmm It's
So
the good core desires, right? But
yes,
the surface level is it's causing pain, but the core
absolutely.
desires are good, right?
So in that survivor stage, then I think that becomes the place where the person learns to challenge all these myths that they have adopted about themselves in the situation. And they start to see the reality of the situation. Maybe you just were in the wrong place at the wrong time. Maybe it was the fact that you didn't have a father in your life and you were hungry for a male's attention, but you had no idea you were going to have to do this to get it.
hmm
But somebody else
hmm
sensed that in you.
Yeah. Yeah.
It's not the fact that you gave off anything that you were gay or homosexual. That's society turning male sexual abuse into something sexual when it is
Mm.
abuse.
Yeah.
It is
Yeah.
violation. It is someone taking advantage of you and your body.
And I think it's a very emotional process to reach that conclusion, because you can tell someone that, right? But it's very different for them to feel it,
Absolutely.
right?
And they have to
Mm.
feel that.
Mm.
So in that
Yeah.
survivor stage, you really help them come to a true reality of what occurred and how did it change who I am and my behavior, my emotions, my thinking, and you work to kind of straighten all that out. And then you figure out, okay, now that I have this newfound awareness, what am I going to do with this? How am I going to now apply this to my life? What are the behaviors, the thoughts, and emotions that I'm going to change going forward? What am I not going to believe about myself? How am I going to show up in relationships? How do I now feel about vulnerability and being able to tell my story? How can I use my story to help someone else? You know,
Hmm.
when you get to the level of being a thriver, all through the literature, there's a phase called making meaning. You've got to make meaning of your story. And once you can do that and articulate it, you can move into being a thriver.
And when people continue to experience these beliefs that come up of all sorts of messages that they've carried from that abuse about their masculinity, and you know, I wanted it, or I was, an active participant in this, or it was my fault, or et cetera, et cetera. How can they respond effectively to those thoughts and beliefs that will come up again and again as they're trying to go through this healing
Yeah.
process?
Well, just for myself, like I said, like I was stuck on so many years because I said yes to this guy when he asked me if he could do something to me. Well, but I have to recognize I had no idea what I was saying yes to. That was not consent. That was me
Yeah.
just spending time with a male friend trying to do something he wanted to do.
Right.
That was not consent to sexual behavior.
Hmm. It's powerful.
Yeah,
Yeah.
so you have to learn to challenge your own beliefs that you've come to believe about yourself.
Hmm.
Like I, I think I was conditioned to have some arousal toward males because of my abuse, but that is not in any way, shape, or form what my heart desires. And that's
Right.
to be, in a fully heterosexual relationship, be a father, raise kids, all the things that I've done.
Yeah. Yeah. That's a powerful message.
But a lot of
And
people
it's,
don't know how to fight those on their own, and they need a counselor to help them begin to reframe all this thinking and to walk into a dark room and start turning on the lights and
mhm.
saying, here's really what's in here.
And if they're kind of ready, if men are ready, they realize they have these deeper wounds, they're in this place where they want to start to change. What are the first kind of safe and compassionate steps that they can take to start healing? We've talked about some of them. Where do they begin?
Well, I mean, there are multiple websites, 1in6.org, survivors, men survivors or the malesurvivor.org is another one. But really just finding somebody to talk to. I think it's so imperative that you find a therapist,
Hmm.
and probably not just any therapist. I mean, you probably need to do your homework and make sure that somebody is trauma informed. There are a lot of people out there who are not used to working with male sexual abuse victims,
Hmm. Right.
and I think the experience of men and women are very different. I'm not telling you that a woman can't work with a man. I'm not saying that. But I think if you can find a male therapist who is experienced in this area, I think that in and of itself could be very healing for you, because you need to have a new, healthy relationship with boundaries with a male.
Hmm.
Just like if there was a man who was sexually abused by a female, I might tell him to go see a female therapist.
Yeah. Yeah. So after all these years of professional work and personal healing for you, Doug, in kind of concluding here, what truth about shame, masculinity, recovery, what do you want people to carry home most of all, or to kind of leave them with surrounding all this?
Well, definitely that male sexual abuse has nothing to do with sexuality itself and where you end up. It may be a layer of the piece, but our sexuality is comprised of multiple layers of development. And you can't just extrapolate one thing out and say, I must be this because of this. You've
Right.
really got to stop and go through all those layers of that onion about, okay, who am I? What makes me? What are all my experiences that make me, not just this one experience or this set of experiences? I'm not going to define my entire existence, my going forward based on this one layer. I am a multifaceted person. I
Hmm.
have this that happened to me, but I have layers and layers of other great things that have happened to me and that I've done in my life.
That's good. Love that.
You need to see yourself in a totality
Yeah. As a whole. Yeah.
as a whole.
Hmm. I like that. Well, Doug, if people want to get in touch with you, they want to work with you, where should they go?
Well, um, my author website is just douglascarpenter.com, which you can go there and you can order my books from there. My books are also on Amazon. It'll just give you a link to Amazon. On my website, my email is there if somebody wants to reach out to me. I'm not technically accepting new clients. I have a wait list. I stay pretty booked up, but that doesn't mean that there are not other male therapists that are out there that can help you through this. If you're somebody who is recognizing, hey, I think this happened to me, I think this is affecting the way I show up in my life, especially show up in relationships, and I need to heal this wound and move beyond it. And like I said, there are men out there who are running small groups, like Mike Chapman. There's another guy in Husband Material who runs groups based on my book and my workbook. So, I mean, there are resources out there for
Hmm.
men who are ready to begin facing this.
Yeah. Excellent. Well, and again, for everybody listening, Doug Carpenter, Dr. Carpenter, his book is Secret Shame. It's a fantastic book. It's extremely well researched and backed up by the science of everything, and then also really hits home with heart in just getting into real men's stories. Very, very challenging and heavy sometimes, but very real and very needed, for people to be able to understand, and then to know that they're not the only ones if they've been through this. And um, very, very good stuff. So thank you for creating that, Doug.
My pleasure. And I hope it helps as many people as it can reach.
Well, thanks. It's great to have you on the show, man.
Thank you. It's great to be here.